Anesthetics is an engaging specialty. It's always moving with the times, and research is one of the ways that it moves. The questions you generate inside the operating theatre when you're taking care of kids sometimes need a research project to answer. They're not questions you can answer as an individual clinician. Our department prides itself on its clinical work, and the research that we do here is based on the clinical cases we see. We've got a range of projects that go from looking at whether anesthetics might have an impact on small babies' brains, through how to give oxygen efficiently during certain types of surgery, all the way through to some work on big data and how to use the information that we generate in the operating theatres more effectively for anaesthetic care of children. In all medical specialties we generate information, and in anaesthetics it relates to things like your blood pressure and your oxygen levels in your blood and a range of other things that tell us how happy your body is during an anaesthetic. Our primary goal is the safety of our patients, and so a lot of the monitors we use are there just to guide us, to give us the boundaries of what's acceptable for the patient. But until recently, that data was difficult to acquire and pull into an electronic and digital system, and it's also really big in terms of its volume. So most hospital electronic systems until recently have not been able to gather and store that information. So Big Data for Small People is a project that aims to grab, capture and store that data in a usable format for both clinicians and for researchers. It's a busy time being a clinician and a researcher, and you just start with small steps. You start on small projects that you're the lead of, and you learn how to do the process. And once you've done that a few times, you start figuring out how you can rely on other people to help out. And gradually a team gets built. You establish relationships with people outside of your department. You get mentors from other places in the country to help you along the way. So it's most of it is about people and building connections with capable people who've got skills that you can't or don't have the time to get, so that you can actually do the research. Research is a complex project to do, complex project management, and it's not something that a single person can do nowadays on their own without others. That depends on how you think of anaesthesia. We are a very tech-orientated specialty, and it can sometimes look as though we're just sort of looking at numbers and fiddling with them and occasionally giving a few drugs. But there is a very human component to what we do in anaesthesia that means we're unlikely to suddenly not have anaesthetists and have some robotic process doing it. So I think what we'll see in 5 or 10 years' time is a lot more assistance from computer systems that are well designed to help patients move through the healthcare system, ways that computers can take over some of the basic jobs that we do so that we can focus on the more human aspects of care.